All right, everybody, welcome back to part two. This is a picture from the TV show Nurse Jackie, which many of you may know. Having watched it, it wasn't on for very long, but it was fairly popular. I watched the first episode and couldn't watch any more than that. Nurse Jackie is the stereotypical, I can't even say stereotypical, she's a stereotype of nurses. She's drug addicted, she's sleeping with the pharmacist to get her medication. It's like this crazy story. Yes, there's more to it. I'm sure it's a delightful show, but as a nurse, I couldn't watch it. And so, what does the public say about nursing? What does the media say? What kinds of things do people think about nurses? And so, I already gave you some examples of some of the stereotypes that are out there. But when we look at shows, and I'm actually going to go down here. So, we have the show MASH, Hot Lips Houlihan. So she, and if anyone ever watched MASH, it was a show that I loved. But she was the head nurse, well educated, came from a military family, did her job exceptionally well. The first day that the two main characters met her, she happened to be making out with her boyfriend and got the name Hot Lips, and it was Hot Lips after. It's just so very much a part of that, the naughty nurse, the sexualized nurse image. In the old TV show of ER, we talk about the characters. There was one character that went on to medical school, and it was actually the second time that they had done that story. The character that Juliana Margulies used to play, her character also applied to go to medical school, did very well, and got in. And so many fans wrote to say that a smart nurse is not a doctor, that they actually changed what the story was, and they did this whole episode on her making that decision of, I really want to be a nurse, I don't really want to be a doctor. And there was a family that had lost their newborn baby, etc. It was a tearjerker of an episode, but they did a really good job, and they definitely responded to the public on that one, especially the nursing public. There's the show House, where the nurses aren't really mentioned at all unless they happen to be dating the doctors. And it's really interesting because House gives people a very bad impression also of what the doctors do, because most of the things that happened on that TV show were not doctor activities. They would say, oh, this patient needs an antibiotic, and then, sorry, that's my dog, the next second you would see them hanging up the antibiotic. When have you ever seen a doctor hang an antibiotic? Doctors put in the Foleys. Doctors were transporting patients to different tests and things. And so people would watch that and say, wow, I want to be a doctor. Yes, this is a crazy show, but people would watch that and think that that's what doctors did, and not think anything of the fact that those are really all nursing activities. It also drove me crazy because the EEG was never correct. A lot of medical stuff wasn't right. And again, I liked that show, but it made me crazy. There was the show Mercy, which Jada Pinkett Smith starred in, and it was really interesting because she was like the CNO, and yet she also happened to help out on the floor, which again, when have you ever seen a CNO on the floor? So that's the VP of nursing is another title. But those people are not moving patients up in bed if they're ever on the floor, ever, if you even know what that person's name is. And yet she happened to go to all the floors and always helped out and knew everybody and helped the patients. It was very strange. On the other hand, Jada Pinkett Smith's mom is a nurse, and so she really wanted to have a role, a TV role that showed what nursing really was, the strength of nursing, the education, and the comprehensiveness of all the things that we do. Nurse Jackie, I just talked about. Grey's Anatomy was another example. Again, the doctor sleeping with the nurses. There was one where it was sort of that Nurse Ratched role, where the doctor did something, said something that was very mean to one of the nurses, and instead of just sort of handling it, she gets back at the doctor for the rest of the day, gives him all the worst patients, sends him in to people who have bowel obstruction, won't help her with any of her charting. But that's not really professional behaviors either. None of that is right. And there was another episode of Grey's Anatomy where they talked about there was a nursing strike and all the nurses just left. They just left. And that would be A, illegal, B, outside of your scope of practice. You would never abandon a patient without there being somebody else there. And so there was a lot of criticism in the show of how could nurses just leave their patients. Well, because that would never happen. That's not how strikes work. And so that was just an interesting aside. So these are really the top shows that have been out, top 6 shows in the last maybe 15 years, obviously a little bit longer for MASH, that have really focused and had nurses in them, but didn't really ever capture what nursing actually was or did. So there's that piece of this. On the other end of it, what are the images of doctors, both male and female? They're well educated. They give all the orders, like I said about House, of they're doing things that are actually nursing activities. And the images of professions that are born out of nursing. So what I mean by that is nursing has stayed, especially in terms of education level, which you all know because you're in this program, has stayed at the LPN level for a very long time, stayed at the diploma level for a very long time. It's just this year, I believe, is the last year that we'll be graduating diploma nurses in the state of Connecticut, and it's 2000, and it'll be 2017 by the time they graduate. So we're still very much hanging on to this role of all nurses can enter nursing in different ways. The associate's degree to bachelor's, and I'm sure you all know the arguments around the bachelor's degree, but we all sit for the same NCLEX. Whereas if you look at physical therapy is something that we used to do as nurses. We used to learn about how to do crutch walking. We used to help them go up and down stairs. We used to help them with cast placement. All of these things just got to be too much for our profession to do, and so we delegated them out, and then it became like a thing. And they created programs and schooling and certifications and things like that, and now they are doctoral level of entry. We're not talking LPN, we're not talking associate's degree, doctoral level of entry, and they get paid like it's doctoral level of entry. But this used to be us. That was our thing. Same thing with the registered dietitians and social workers. We could say the same thing about pharmacy. There are many things now that have all become different specialty areas that we collaborate with, whereas nursing has really stayed the same. We're the biggest part of the profession, of the healthcare profession. And yet we have, compared to everyone else, a lower level of education, and we certainly don't have as much in terms of financial contribution. So for example, you could look at somebody that's a registered dietitian would have their master's, but you have an associate's degree, and then they become a dietitian or a dietetic tech. Same thing with somebody that's working in radiology. There's the radiologist, who's a doctor, and then there's the radiology tech. And those people usually have an associate's degree. Social workers is a master's degree. So we look at all these things and how they've really come out of our profession and yet have gone beyond in many ways in terms of professional clout and responsibility and things. So just something that we need to think about. This video I'm not going to play for you. I'm going to allow you to do that on your own. Because this is a video, you can't click on this, so please don't try. You're going to have to go to the Blackboard page and then click on it directly from this, or you can just copy it down, whatever you see here, and be able to do it. But you're not going to be able to highlight and cut and paste. But it's just a video talking about really the sexualized nurse, the naughty nurse image, and why does that matter, which I think we've talked enough about. All right, so research and knowledge. Nursing is the largest branch of healthcare providers, which I just said. When a health-related article is presented in the paper or in the news on TV, whose research does it come from? Do you ever see nursing research on TV? Not usually. It's usually all doctor, doctor, doctor. And that mostly comes from the people who work in TV and news. Think of doctors as being the ones who do research. They don't think of nursing as the profession that has their own research. And quite frankly, all of those other disciplines that I told you about, them and many others, they also do their own research. But that's not what happens. So what is nursing's stance on healthcare reform? Well, we have an official stance. It comes from the American Nurses Association. You can go to the ANA website and find out what that public stance has been and see if it matches what your stance has been. But do we talk about, for all the conversation around the ACA, how many times have you ever seen them talk to the nurses? Whether it's staff nurses or professional nurses who discuss things like coverage and access to healthcare. When there's nursing issues such as shortages, nursing school issues, laws, who gets consulted? How many times are there nurses on any of these boards or committees? And what does any of that have to do with this? Well, this is our last slide. The difference is that we are a large group of people, the largest group of people in the healthcare profession, and yet we don't utilize our voice. And we give away a lot of our power, for example, with physical therapy. Respiratory therapy is a fairly new discipline, and yet that one has also come with the same increased level of education and things like that. These are some of the issues that we'll be talking about in the next few weeks. We'll be talking certainly about racism, sex, gender, sexuality. Sex is basically the parts that you have. Gender is how you express that sex. And sexuality is who you like. And so 3 very different aspects of diversity. The image of nursing, ageism, racism, and that's pretty much it. So that wraps it up for now. Like I said in the first section, I really want you guys to focus on putting some more information up about yourselves personally so we can all get to know you and our cohort a little bit better. And that's all for now.